I thought it might be helpful today to explain the reporting cycle for the results so that people understand when I get to see them. It might give them a bit of an insight as to how things work behind the scenes. So obviously people will start coming to the clinics to be swabbed and screened in the morning. It will take a finite length of time until the teams have collected enough samples to go to the labs. And once they've collected enough and sent them there, each of the PCR runs takes 4 to 5 hours and some preparation in advance of that, getting the samples registered and so on and so forth. So in fact, I don't usually get to see any results in the morning until perhaps around 10 or 11 at the earliest, and then they start to accelerate as we approach 6 o'clock, the end of the working day, and 7 they usually begin to stop. Clearly, in the case of our current outbreaks, they have continued, and as I've mentioned previously, the laboratories have been working well into the night, and the results continue to come until 2 or even 3 a.m. So you can see how hard they're working, and our collective thanks to them. But that's why when I wake up at around 5 in the morning and before I walk the dog, I sit down in the computer waiting for the sun to come up a little and put all of those results into a spreadsheet and begin to collate them. So a big bunch of reporting happens at around 7 a.m. when I've collected everything together. Thought that might be helpful for people to understand that cycle. Overnight, we have had some further reports of positives. So just as a summary from yesterday I reported a total of 10 people related to the Georgetown Primary School outbreak, of which 2 are adults who had been related to somebody who had visited the school. Today, unfortunately, I have to report a further 9 children that are related, and these children across yesterday's reporting and today are in years 2, 3, 4, 5 and 6. The outbreak investigation has not yet completed. We're still trying to trace a few more remaining children and their families. So please do remain indoors in isolation until you are given a message to say that you can be released. Of course, any primary contacts that we identify are immediately contacted by public health, given support, advice, and so on. But in any event, everyone related to the incident who's been asked to remain at home, please do so until you're advised otherwise. Overnight, we've also heard that there is a prison officer who unfortunately was feeling unwell yesterday. That person is fully vaccinated, so hoping that person will make very good progress. But that has obviously put the prison in a difficult position, and they have instituted procedures in order to protect both the staff and, of course, very importantly, the inmates of Northwood, Her Majesty's Prison Northwood. It is good news that within the press release from the prison service, we have seen that they have around 60% of their staff fully vaccinated, and additionally, I know that over half of the prisoners are vaccinated, so they are in a relatively good place. But because of their particularly vulnerable nature as an institution where people necessarily cannot always distance, we're particularly concerned about this and would like to offer our thoughts with all of the teams out there who are having to work very hard, and also with everybody who will be very worried about it. I am well aware that there's quite a bit of respiratory sickness going around and some gastrointestinal sickness, and that's will make people worry at the time when we have a known COVID outbreak. I think what's really reassuring to know is somewhere in the region of 6,000 PCR tests have been done since last Wednesday, when we found out about the first community-based outbreak. That's near enough 10% of our population, and within that huge figure, there have been relatively few people that have been positive, and they seem to be related to these incidents, so that's good. If you do happen to feel unwell, please stay at home. If you need further advice, ring up your own GP, your own health clinic, or the flu hotline for advice. They'll let you know if they feel you should go and get yourself tested for SARS-CoV-2.